Hello and welcome to another episode of Discover with Spinetti. I am your host, Dr. Spinetti. Today we're going to be talking about dental implants. So if you're missing a tooth, you want to stick around and learn a little bit more about your options of what to do with that missing area where you don't have a tooth anymore. It's probably the most important thing you could do in your oral health because you're preventing a lot of bad things from happening. So that's what we're going to be talking about today. Yesterday, we talked about the series. As you can see here, it says episode 55, but today is actually episode 56. So with episode 56, day 56, Ramadan number, day 4. What else kind of cool things that are happening today? And it's Thursday, the day before Friday, which is the 4th day of the week. See, and it's the second last day of March break. We're just rolling today. So dental implants, that's what we're going to be talking about. Dental implants is where it's at. Now let me just include the people here on Instagram because I know you're itching to actually get on. So now that I'm live on Instagram and I'm live on all the platforms such as Facebook, multiple platforms on Facebook, LinkedIn, YouTube, X, and of course Instagram. So again, welcome. I am Dr. Spinetti. I was going to say I am Discover with Spinetti. I am Dr. Spinetti on Discover with Spinetti. Yesterday, we talked about veneers. We spent 10 minutes talking about veneers, and we talked about everything at length with regards to veneers, specifically with regards to the 4 to 5, maybe even 6 questions that are often asked with regards to veneers. So if you missed that one, then check it out from the day previous. That's episode 55. Today's episode 56. We're going to be talking about dental implants. We're going to be talking about certain questions in regards to dental implants. So we talked about all this stuff yesterday. Today, we're going to be talking about this. What are dental implants? How long does a dental implant last? Because a lot of people don't know how long it lasts. It is very expensive. So is it worth the investment or should you just leave it there? And what happens if you just leave it there? How painful is getting a dental implant? What is the best age for getting a dental implant? Now, as you can see, as I'm talking, I'm telling you a question that isn't on there because that's one of those questions that it's involved in part of those questions, which is how long does the implant last? Well, what happens if you don't have an implant? So before we get into that, we're going to talk about first what are dental implants, because if you're exploring that area and you're kind of scratching your head, wondering what you're going to do with that missing tooth, and is it even important, or can you just chew on the other side? I'm here to answer those questions for you, because if you don't, you could be costing yourself a lot of money in the future, a lot of headaches, a lot of more missing teeth, a lot more missing bone and gums. And I'm telling you, you are not saving yourself any money by not putting an implant in. You're actually causing yourself a lot of headaches, and you're heading towards a very dangerous path in your mouth. What are dental implants? Dental implants are simply a surgical procedure that, as you can see here, it's a titanium screw, and the titanium screw can either come in titanium or can come in zirconia. Okay, but either or, whether it's white or metal colored, whether either or, that is a dental implant. So I know you can't see the mouse, so I'm not going to use the mouse, but I'm going to, or the cursor rather, but I'm going to kind of just illustrate it, maybe using my finger. Or actually, no, I'll use my pen. So imagine this is the implant and this is the post. And this here is the bone. This is the bone. So this is the implant. That's the bone. So imagine here, this is the jawbone. So I'm kind of taking it out of my face and putting it in front of the camera like this. So use your imagination. And then I'm using this pen as an implant. And what we do is that we put this implant into the jaw and it kind of just disappears like this. Okay. Obviously, it doesn't come out from your jaw, but it kind of disappears like that. Okay. So just imagine the jaw's like this. All right. It's a big jaw. So now you have the implant portion in your jaw. Okay. Now the implant is actually in your jaw right now. That's it. The implant's in your jaw. What most people think is that the implant is the whole thing. They think it's the crown, the abutment, and the screw, and the actual implant, but it's not. The implant is the titanium quote unquote screw. That's what it is. So when you're using that, when you're putting it inside your jaw, you're not putting it, the surgeon's putting it in your jaw, then now you need a crown. So here's a question that a lot of people ask me. Can they get a crown? Sorry, not rather. Can they get an implant in their jaw but delay the crown portion? And the answer is yes, you can. How long? Kind of indefinitely, actually, because as long as the implant is buried and it's buried underneath tissue, then the bone's really not going anywhere because the bone's holding on to the implant. Whenever you're ready, then you get the crown. So the procedure is actually in two steps. The first step is you get the implant inside your jaw. Okay, so now it's part of your bone. And the second part is now you get the crown portion. The implant portion going into the bone is around 3 months healing time, give or take. And also give and take whether or not you actually need any kind of other procedures, such as bone grafting, or if you need gum grafting, et cetera, et cetera. If you need more of those procedures, obviously the healing time is a lot longer. But if you don't, and it's a very straightforward case, and we can just put an implant in right away, then the healing time is around 3 months, sometimes even shorter. Okay, it depends. Now, after the 3 months, then what happens is that you go back to your dentist, and he or she then puts on a crown. Now, the process is a 2 appointment process. So you go in, they take the impression, whether it's digital or whether it's through the traditional sense, that gooey stuff that goes in your mouth, goes everywhere. We call that, not alginate, but we call that PVS, fancy term. And then 2 weeks later, after they take the impression, 2 weeks later, then they do the crown. They deliver the crown. Okay. It's actually a very simple process once you know how to do it properly. Everything's easy once you know how to do it properly. Let's be honest. So that's what a dental implant is. Now, am I fielding any questions? I'm just going to make sure that you guys aren't asking any questions. Okay, so you guys aren't asking any questions yet. All right. Cool. See, now I'm keeping an eye on whether or not you guys are asking questions. If you guys are asking questions, it'll pop up here on any platform except Instagram, so I have to click back on Instagram. Okay, so now you know what a dental implant is. Now, what happens if you don't get a dental implant? Let's say now you have a missing tooth. Let's just say you have one missing tooth. And you're like, you know what? It's not bothering me. I can still chew. Yeah, I can't really chew well on that side that I'm missing a tooth. So I'm going to chew more on the other side. Not a big deal. Not the end of the world. I'm good. What you don't understand what's happening is there's a lot of changes that are happening. I did cover it in another podcast previously. I'm going to say it again just because I've said it before. So now I can say it with more oomph. Now, what happens is that a lot of shifting happens. Okay. So the first thing that happens is that you start losing your bone. That's number one. You start losing your bone. Second, you start losing gum tissue. When you start losing bone, you start losing gum tissue. Now, the teeth that are on either side of the missing area, they're going to start to shift inward because there's nothing holding them in that position. So they're going to start shifting inward. Now, you're creating space in between those teeth. So you're creating space between those teeth. You're closing that space, and you've lost bone and gum tissue. Now your bite's completely changed at that instant, right? So now you've introduced more area where bacteria can actually get trapped, where food can get trapped, and it makes it a lot harder for you to actually keep that area of your mouth clean. Now, furthermore, what happens is that the tooth opposing it, okay, so the tooth on top, or if you have a missing tooth on the top, the tooth on the bottom starts to come out of the bone. So whether it's on the bottom or on the top, starts to come out of the bone. Now, when it comes out of the bone, now you're introducing more space in between those teeth that are on the top, like that are on either side of the tooth that's coming down. Okay. I wish I had the illustration. I don't have the illustration. So you're going to have to kind of use your imagination. Just understand one thing and one thing only. There is a huge catastrophe with you not replacing that tooth. Now, Dr. Spinati, can we put a bridge? Yes, you can definitely put a bridge. But a bridge means that you're sacrificing both teeth on either side of the missing tooth. Because the dentist has to remove tooth structure of both teeth. So now you end up with a 3-teeth problem as opposed to only a 1-tooth problem. Because we both know that nothing lasts forever. And at some point, that bridge is going to be replaced. And what you don't know probably is that when you put a bridge, the reason why you actually lost a tooth to begin with, more than likely, is due to a cavity. So more than likely, it's because you hate flossing. And because you hate flossing, that cavity got big. And then more than likely got a root canal, or you couldn't afford a root canal, so you got it extracted. And now you're putting a bridge on, and a bridge makes it 10 times harder for you to clean underneath that area. So now both those teeth are now highly susceptible to getting cavities. And guess what? you can possibly lose them, or they both need to get root canals and a new bridge. So I'm just telling you that by you not putting in an implant in that area, you're actually sacrificing quite a bit. It's not saving you any money at all, and it's costing you a ton. And it's also one thing that most people don't think about is that when you go to the dentist, guess what you have to do? You have to take time off from work, which means more lost income. So that jacks up the price even more. But you don't even think about that, do you? You also don't think about all the pain that you have to endure with all these needles at every single appointment for you to get all these procedures done. Why not just get an implant, replace that missing tooth, fork over that implant? At Spinetta Dentistry, we do have a payment plan, but I'm sure your dentist may have a payment plan as well. Ask if they do, and then get an implant. Save yourself a ton of work in the future. Save your bones, save your gums, save your teeth, and just live life normally. A lot of people say, "Oh, well, I can't afford it." I would argue and say, you can't afford not to do it. It's kind of like when you're driving a car and your tire kind of pops, or you fall into a ditch and and your tire needs to be replaced. Well, you need to fork over a few $1,000s for you to replace it. You have no choice. Yeah, man, maybe at that moment you can't afford it, but if you don't fix it, you can't get from place from A to B. If you don't fix your tooth, then at some point in your life, you won't be able to chew properly. I've seen it, and many other dentists, if not every single dentist out there, has seen it as well. So ask your dentist what happens when you're missing that tooth and you keep that tooth right there. You keep that area of you keep that missing area. Wow. And you keep that missing tooth missing, if that makes sense. You gotta love it when it's really impromptu and kind of just like speaking off the cuff, and it's live. So I can't really edit it. So I can't edit it out. Okay, let's get. Oh my goodness, it's 12 minutes. Someone should just buzz me and say, dude, like 12 minutes. You should have stopped at 10. Okay, let's get through this quickly. I hope you got the point of what happens when you're missing a tooth. Okay. All right. So these are what dental implants are. How long dental implants last? As you can see, this nice gentleman right there. And I don't know if it's a dentist or hygienist or an assistant, whatever. But he's looking at his teeth. It looks like he's got some implants. He's happy. How long do dental implants last? Dental implants, according to the most recent research, they last between 20 and 25 years, but they can definitely last longer. But that's the average. So some have lasted a lot longer, maybe 40 years or maybe more. Some have lasted less. But there's a lot of factors that come into play with regards to how long the dental implant is going to last. And the biggest factor is how well are you at maintaining it? Because dental implants are different than your teeth, their maintenance is a little bit different, not too much different, but a little bit different. In other words, one of the things that you cannot do is you cannot floss aggressively around dental implants. You actually have to be very careful, because if you jam the dental floss down into the gum all the way down into the implant, you're actually severing the attachment of your gum from the crown area and the implant area. And you don't want to do that, because if you do that, now you're introducing bacteria in that area, and you're more than likely going to start losing bone around that area. So what I would recommend is, if you have implants, is for you to be very gentle with your floss. And as soon as you get to right underneath the crown, to stop there. You don't want to go all the way down and sever the attachment from the implant and your tissue. Okay. So, and if you're having any questions and you're confused with regards to what I just said, ask your dentist next time you go to the cleaning, which brings me to the next point, and it's 13 minutes, almost 14 minutes. Bringing me to the next point. The next point is that if you get an implant, my recommendation is you should go to the dentist at least every 4 months. Now, is that overkill? No, it's not. Because if I have an implant in my mouth, I'd rather spend a little bit of money to maintain it than for me to make sure that no infections are around it, so I can enjoy it, and the gums stay healthy, and the dentist is keeping an eye on it, so that if I'm going to lose bone, or if there's any bone being lost, or whatever issues they're caught early on, so that they're not exacerbated or made worse if I just leave them unattended. And also, the hygienist is trained well for them to clean around the implant, because they don't use the same instruments as the instruments that they use around your teeth. There's different types of instruments, because you don't want to scratch the implant. So that's the second factor. Third factor is whether or not you're smoking. If you're smoking, for sure, your implant's not going to last long. If you're not a smoker, your implant's going to last longer. If you're diabetic, if you have any immunocompromised states, those things can affect your implant longevity. So those are kind of some of the things that you should keep in mind. But the biggest two things are, one, if you're maintaining it properly at home, meaning that you are brushing properly and you're not flossing aggressively around the implant. And might I add, because I said home, might I add also wearing a night guard. 100% you need a night guard. And the second is for you to go in to see your dentist every 4 months for you to make sure that there's no plaque being accumulated around the implant, because that could be disaster for the bone, because you could be losing bone. All right. Someone just gave me a like. Thank you. Appreciate it. Okay. Now, how painful is it to get dental implants? Okay, I'm going to wrap this up. How painful is it to get dental implants? It's not. Actually, to be honest with you, the majority of my patients who I put dental implants in literally tell me the next time I see them, they didn't feel anything besides a little bit of discomfort from the area of surgery. Like, that's what they tell me. They said, I didn't take any meds. I didn't take any meds, any painkillers. Literally, they tell me this. And this is across all age groups and across a lot of different medical conditions. So I'm telling you that putting an implant is not as scary as you think it is, if that is the fear factor for you not to get a dental implant. It's not painful because you're going to be anesthetized. You're going to be numb when you get that implant done. So is it painful? It's not. Lastly, this is the last question, people. What is the best age for get dental implants? Now, I have a lot of patients who are young. Either they're congenitally missing teeth, so they're missing teeth at birth because, when their teeth are forming, some of the teeth didn't form, or they got into some kind of trauma and now they're missing a tooth. Now, this is what I say, okay? And this is the general consensus across, the platform, across all dentists, is that if you are less than 25 years of age, it's highly recommended for you not to put an implant in your jaw. The reason is because if you put an implant in your jaw when you're less than 25 years of age, you're actually sacrificing the way that the implant is going to be in your jaw, because your jaw is going to keep growing. So one of the likely scenarios is what happens is that if you put an implant inside your jaw when you're less than 25 years old, is that the implant starts to get buried further and further down, and so then the actual implant, the emergence profile of the crown, doesn't look very good. It actually starts looking really bad. So that's one of the biggest reasons, actually probably the reason, as to why you should not hurry and get a dental implant when you're that young. The second reason as to why you shouldn't, and you should delay it as much as possible, if you're congenitally missing a tooth. Okay, because if you're congenitally missing a tooth, that bone area is going to stay the same. There's not going to be any change in the bone because that's how you're born. So if you delay it as much as possible, then you have a much higher chance of keeping that implant inside your jaw for the rest of your life if you delay it as much as possible. And one of the ways you can delay it, especially if these implants are in the front, and this is particularly for those people that are considering doing an implant in the front, in the aesthetic zone, is for them to get something called a Maryland bridge. Now, a Maryland bridge is incredibly conservative, works incredibly well, and has a very long lifespan inside your mouth. And it's literally just a bond on the back of the tooth, and it looks incredibly good if it's done well. I wish I actually there is a post that I put on the Instagram feed where I asked which tooth is fake. And one of those teeth is a Maryland bridge. So if you want to see what a Maryland bridge can do or can look like and how real it can look, then go ahead and check that out. Go to the Instagram page of Spinelli Dentistry and you can actually see it. It's actually really cool because you can hardly tell there's a fake tooth there. Okay, so that's it. I really went over my time. It's 19 minutes. I really wanted to stop at 10. Sometimes I get carried over. I really want to deliver a lot of value, and so I just keep talking. All right, so that's it for today. Hope you're having a great day. Happy Thursday. Stay well. And as always, keep smiling. Good night.